बंद शहर हो या दरवाजे, सब बोझ खुशी से लेती है। क्यों ना आज मैं हाथ बटाऊं, क्यों ना आज मैं साथ निभाऊं। माँ हो या फिर मेरी पत्नी या घर की लाडली बेटी, क्यों ना उसका हाथ बटाऊं, क्यों ना उसका साथ निभाऊं। बंद शहर हो या दरवाजे।
Morning everyone. I hope you all had a good day yesterday and you're looking forward to today's session. Just a quick reminder on the instructions. Please switch off all your microphones and videos. Our team will also be taking care of keeping all your microphones off. We request all of you to change your names on your Zoom meeting, Zoom meeting surface, because we are not able to identify who has entered. We request all of you to write down your questions in the chat box. Please do not share your personal information on the chat box. We request all of you to switch on your videos towards the end of every session. If you are comfortable, that will be just for a group picture. At the end of the course, we will be conducting a test and we'll be sharing the feedback form and the questionnaire with you. I hope you all are taking copious amounts of notes because these sessions have been really enriching. Participants will receive the certificate after attending all the sessions, completing and passing the test, and completion and returning of the feedback form. Now, I would like to introduce Dr. Sharada to go ahead with today's proceedings. Dr. Sharada.
Thank you, Gulati. Good morning, everyone. Welcome back to the 4th day of the 5-day certificate course on reporting on COVID-19 through a gender lens. We are slowly inching towards the closure of enriching 5 days. Yesterday's sessions on livelihoods and education and gender-based violence were quite comprehensive and have revealed how COVID is going to impact girls' education and women's safety. I am sure you have gained new insights and more nuanced understanding of the issues. Media tends to cover women usually as the victims or the recipients of doles and support in the context of calamities, both people-made and natural. Their role in rescue, rehabilitation is not focused upon much, and their role as peacekeepers and program managers is almost not given any attention. Media needs to write about women in these roles as well. Today we have with us two eminent women leaders, Sujata ji and Kusum ji, who have been empowering women economically through self-help groups. They have been bringing about transformative change in society. Thank you so much, Sujata ji and Kusum ji, for accepting our invitation and joining us today. On behalf of Population First, UNFPA, and all the participants, I extend a warm welcome to you. As we all know, the women SHG group members have been playing a major role in the relief work at the grassroots level. Though many of their income generation activities got impacted badly during the lockdown. It would be interesting to know from the esteemed speakers how the SHG group members are responding to the crisis. In the second session, we will have Mr. Sainath joining us. He is an eminent media person and Magsaysay Award winner to speak about the impending agrarian crisis and its impact on women. There have been requests to open the blog. This is good news for many. The blog contest to non-journalist students as well. And considering the enthusiasm of some of the participants, we have opened it up to all the participants of this certificate course. I hope all of you are very happy about it. I request Swati to share the details once again.
Yes. So as you can see on your screen, the details for the blog competition, you can choose to write on either of the, you can the three topics: child marriage, pre-birth sex selection, and female genital mutilation. The deadline is 25th of June. The word limit is 500 to 750 words maximum, and you can send us your entries on trainings.popfirst@gmail.com, and you can write in both in Hindi and English. Over to you, ma'am.
Before we start the day 4 session, I request Ms. Anuja Gulati, Consultant Program Management, UNFPA, to briefly summarize the major learnings from yesterday's session and give her views on the issues covered so far. To provide an overall context for today's presentations, because each session leads to the other sessions, and we are building up on our understanding day by day, and also for the benefit of the new participants and our speakers. Remember, revision is an important means of learning, and we want you to take with you some key learnings from this course that would guide you during your professional journey in future. Over to Anuja.
Thanks, Sharada, and good morning, everybody, and welcome again to day 4 of the session. We had two very, very enriching and thought-provoking sessions yesterday, and the discussions following those were even more interesting. Dhanashri Brahme brought out how the lockdown has impacted access to livelihoods and food security at the family level, and how this would impact the education of children. She shared findings of a survey that were conducted by Magic Bus, the organization she represents, which brought out that close to about 50% of the respondents, and about 3,500 respondents were surveyed, revealed and to be precise, 44%, revealed that either they themselves or a member of their family had lost a job or livelihoods during the lockdown. About 64% of respondents reported a loss in wages. Because of loss of livelihoods and wages, 69% of respondents mentioned that they had to make adjustments in food habits, with 33% saying that they reduced the number of daily meals, about close to 40% saying that they had to make do with less nutritious food, and about 1/5 saying that they were eating smaller portions of meals every day. She also said that gender differences were visible, with more females making adjustments compared to males. Because of a loss of livelihoods, Dhanashri mentioned that it was likely that children would be made to drop out of schools to help with the paid or the unpaid work at home. The study also brought out that while 90% of parents wanted to send their children to school, and about 97% of children themselves wanted to go back to school, an overwhelming 41% said that they might have to drop out of schools because they would not be able to pay the fees. She concluded by saying that it would be important to restore livelihoods to address household poverty, enhance the family to invest in education of children. Manishaji's session was on violence, and it was as thought-provoking as her earlier session on harmful practices. Manishaji brought out the covert and overt forms of violence against women and how these are perpetuated by patriarchy. She also talked of the linkages of violence with health, and said that violence impacts physical, mental, sexual, and reproductive health of women. On the other hand, ill health can also lead to violence. For example, she said that women facing long-term violence, long-term ill health like tuberculosis, sexually transmitted infections, etc., and also women who are either infertile, childless, or have been giving birth to only girls, are at the risk of facing higher violence within families. She also said violence... I'm sorry? Am I audible, or is there an echo?
Yes.
There is an echo, ma'am. Maybe you could keep your mobile away a bit. Maybe that will
I
help.
don't have it very close though, but fine.
Yeah, it is fine now. It is fine.
Thank
now.
you. I'm sorry for this disturbance. She also said that women who have undergone tubectomies, hysterectomies, or who are pregnant face a higher risk of violence because it is perceived that reproductive values diminish during these times or get reduced during these times. She said that the loss of livelihoods has exacerbated practices such as dowry, another harmful practice, and also unequal distribution of food at the family level, which was also brought out by Tanashri. She concluded by stating that the need of the hour is not social distancing, but physical distancing, truly in the sense of the word, and that we need to maintain social cohesiveness to challenge patriarchy and uphold what our constitution stands for. It's also a privilege for me to be welcoming our two speakers today on behalf of UNFPA. Ms. Sujata Karthikeyan, who heads the Mission Shakti, one of the largest collectives of women in the country, with a membership of almost 70 lakh women spread over 6 lakh self-help groups. It was under her dynamic leadership that the self-help group movement in Orissa took up the challenge of responding to the pandemic and reach out to those in need and people living in vulnerable situations. Thank you so much, Sujata ji, for joining us today. We're really happy to have you with us, and we look forward to an enriching session. We also have Kusum Balsaraf, who is the General Manager of the Mahila Arthik Vikas Mahamandal, commonly referred to as MAVIM. Kusum has been a dear friend, and we've had a very interesting and useful partnership with MAVIM about a decade ago. UNFPA partnered with MAVIM when we joined hands to build capacities of women from self-help groups in order to ensure that their health-seeking behavior gets improved. She has also undertaken numerous innovations to ensure that SHG women actually live up to their motto of self-help and solidarity. Kusumji, a personal welcome to you to the session, and thanks for joining us today. Over to you, Swati, for the rest of the session.
Thank you, ma'am. So we will be starting today's session. The session will be slightly different. We'll have two short presentations on role of SHGs in COVID-19 response, where our speakers will give a depth to the existing discourse around the COVID response in rural and non-urban areas from the community members themselves, especially the community groups like SHGs. Each of our speakers will present for roughly about 20 minutes, and at the end of the session, we will be summarizing their points, and a 15-minute Q&A round will be taken ahead. So today we have with us Ms. Sujata R. Karthikeyan, Odisha Cadre IAS Officer. She's presently leading the Odisha Women's Self-Help Group Movement, Mission Shakti, as its Commissioner-cum-Director. In her 19-year career span till date, she has held several positions in the government departments, such as District Collector, Director, and Commissioner. Mission Shakti, as a pioneering women's empowerment initiative of Odisha, has drawn national and international attention for many of its transformative initiatives. SHG convergence with government departments on promotion of livelihood schemes and programs, financial assistance through Mission Shakti loans, digitization of SHGs and e-commerce platforms, and mobilizing 70 lakh women in 6 lakh SHGs are some of the major achievements made by Mission Shakti in recent years. Also with us, we have Ms. Kusum Balsaraf, a social development and gender specialist. She's the General Manager of Mahila Arthik Vikas Mahamandal MAVIM, which is for the last 18 years, and she has been associated with this organization for the last 30 years under various capacities. MAVIM has interacted and collaborated with various organizations like IFID, UNFPA, UNDP, ILO, and even national organizations like NABARD, central and state government, women's and child departments, planning departments, and minority development department under the National Urban Livelihoods Commission, among others. Welcome both of you. And now I would like to invite Ms. Sujata Karthikeyan to share her insight on the role of SHGs in COVID-19 response. Over to you, Sujata, ma'am.
She has to unmute herself.
Can someone unmute?
Hello, am I audible now?
Yes, ma'am.
Yeah, okay. So thank you for that lovely introduction. As I heard, we'll just have 15 minutes, no? So I'll try to put in what I have
20 minutes,
to say.
ma'am. 20 minutes, yeah.
20 minutes. Okay, right. So I'll stick to that. Just let me know when it's 20 minutes, huh? Just let me know. So I thank all of you for inviting me. Actually, the Mission Shakti movement or the self-help group movement of Orissa is not very well known across the country. We hear about Kudumbashri and we hear about what's happening in SERP and we hear about the Bihar experiment and all. But Mission Shakti has been relatively low profile. So I'm happy that you've got me to this platform to share our experiences, because even though it's low profile, a lot of very, very aggressive, dynamic work is being done by our women. So it's a good platform to share this with you all. The Mission Shakti movement started in 2001. It was a self-help group movement and it was a state's self-help group movement. It was started by the present Chief Minister, Mr. Naveen Patnaik, in 2001. Today, it comprises 70 lakh women in 6 lakh households. I can roughly, with full assurance, say that almost 80% of all households in Orissa, whether urban or rural, this is both urban and rural, have at least one member belonging to Mission Shakti. So that is a huge spread. And the way this movement grew in Orissa is our Anganwadi workers nurtured this movement. So this was not under BDOs and Panchayati Raj department, which traditionally has a focus more on thrift and credit. Our Anganwadi workers nurtured this movement, and because of that, because it stayed with the Women and Child Development Department, the focus of the Mission Shakti movement, even though thrift and credit is a huge pillar of any SHG movement, however, our focus became how to develop grassroots leaders who work in partnership with government and they act as a bridge between government and community. So over the last 20 years, if you see in detail, our self-help group movement has always stepped in whenever there have been major requirements of linking to the community. And Odisha being a state which faces natural disasters almost every year, we have this huge machinery that works from end to end, from sensitization to rehab to rehabilitation to taking up economic activities throughout the whole period. So it was but natural when COVID and the corona pandemic came around early this year, and by March it started hitting most states. We had our first cases around mid-March. So early on in March, the state government took this decision that for sensitization of the community, we need to first equip our self-help group leaders. So they have been working from sensitization as frontline workers. It's not only Asha and Anganwadi workers who have been frontline workers in Odisha. Our self-help groups have been major frontline workers trying to identify cases and get them isolated. Then, as I said, they are leaders in the community. They are not groups who just put money together and take bank loans. They are leaders in the community, and people in villages and urban areas look up to them. And lastly, they formed the bridge between government and community in a very beautiful way. Today, if Orissa is being talked about on par with Kerala for handling coronavirus pandemic, I would say a huge chunk of that success goes to our 70 lakh self-help group women leaders. So I would request you to start my presentation and I'll run you through the presentation. That would give greater clarity, I think. Can somebody run the presentation?
Yes, ma'am. We are just doing that.
Yeah. So this would help you. I mean, I would take you through the phases in which it happened. So first was when sensitization was the key. You know, people did not know what is coronavirus and how to protect against it. We had to reach every household to tell them that pehle jaise mahamari aati thi, and you know, we used to take care of our people, isolate them, and in terms when they get serious, then you contact. You don't immediately rush them to a hospital. All these things. What is hand washing? What is the use of soap? Why wear masks? So ghar ghar pahunchane wali, these were our women who took them to every household. Yes? Yeah. Could you go to the next slide? Yeah. And can we make it a play screen shot? Yeah, thank you. So this, as I said, this is how our self-help group movement has grown from 2001. So we'll just skip this. Today, we have 70 lakh women in it. Next slide, please. So the first thing that our women did was mass awareness. So we printed leaflets and every house got that leaflet about what was coronavirus, which you see is a huge thing if you have to reach 6,800 gram panchayats and so many urban bodies. Then the second thing they did was our CM said that everybody should take a pledge that I will stay at home. It was called the Mo Jeevan Pledge, My Jeevan Pledge. And this was taken by our 6 lakh SHGs in their homes, outside, in small group meetings, that I will not step out of home and I will break the cycle of coronavirus. The third important thing they did through our digital communication, we have empowered our SHGs through smartphones. So circulation of all government regulations, health advisories on both WhatsApp and other apps were done for this through the 70 lakh women workforce. Next, please. So this was the first phase. The second phase, when lockdown was imposed in the entire country, our groups realized that there were certain limitations that were happening during lockdown. I mean, there was a huge requirement of masks. Maybe in urban areas, people could, but even in urban areas at that time, there was a huge demand for something to cover the face with. And our SHGs got into the whole job very early on. And I'm very happy to share that till today, almost 6 million masks have been produced by them and disbursed. And many of them have disbursed it even at free of cost or at very, very reasonable rates so that they help the community while earning a bit of income staying at home. Next. Then during the lockdown, you see there was this huge requirement of vegetable and ration shops because the existing ration shops closed down. So again, district collectors and block development officers turned to our SHGs to set up mobile vans, mobile ration shops, and even standalone ration shops. So here you see many of our SHGs happily doing this work. And almost around 752 SHGs. This I'm talking about the early period during lockdown. Next. Our government took a decision that probably hunger will hit people harder than coronavirus. So from March, 26 March onwards, we started a free kitchen program in every Gram Panchayat and urban area where any destitute person, elderly person, a person living alone, a person having no means of earning livelihood could come and have 2 free meals in a day. And this was provided by our SHG. The funds were paid out of CM's relief fund and an incentive of ₹2 per meal was given to our SHGs. This really took away a huge burden of the hunger that a society could have faced, and it was a very, very important initiative. Our SHGs are still in the process of preparing meals in all those panchayats and urban bodies where meals are required. Next. Then you see our Anganwadi centers where pregnant women and children are given take-home ration. In other states, there are different means of doing it, but in Orissa, our self-help groups provide the take-home ration. So that continued without fail because it was targeting a very, very vulnerable population of pregnant women and little children. Next. Then a decision was taken by state government that 4 months worth of ration under the PDS system would be distributed in March so that people don't have to, at that time one didn't know how the pandemic was panning out. So we wanted food in every household. So 4 months of ration was distributed to all PDS beneficiaries. And in this also, many of our SHGs run fair price shops and they could do this without any hassle. Next. Then I'll show you, there's something where we have a 5 rupee meal scheme, which is the Ahar Kendras, where in important bus stands, railway stations, hospitals, food is given, typically rice and dal with vegetables, which is called dalma here. That is given, and that is also, many of these centers are run by SHG. So 5 rupees contributed by the person who's having the meal, and the rest 15 is given by government. So this was the next phase. What I just told you was the next phase, where during lockdown, important issues of how to manage hunger, how to take care of pregnant women, destitute people, how to manage the need for masks, this important thing was taken up. So from sensitization, which was the first phase, Second phase during the early lockdown, which was a very strict lockdown. Then comes from April, when green zones opened up and the rural economy had to be, kick-started. Again, our SHGs played a very big role, because all of us working in gender know that money in the hands of groups of women in rural and urban areas has a huge, catalytic value. So then aggressively SHGs were requested and targeted to take up major activities. And in Orissa, we have a cabinet resolution of last year after this government took over power. There is a cabinet resolution which says that 1,000 crores worth of government procurement every year will be done through self-help group movements of Mission Shakti. So in 5 years, 5,000 crores worth of government procurement will be done through SHGs. So what kinds of government procurement? You see school uniforms, take-home ration supply, electricity meter reading, wherever women can play a role and earn a commission, like paddy procurement, things like that. So focusing on that, economic activities were started. So the first one, obviously, most of our women are agriculture-based and allied activities based on agriculture. Orissa government has a policy directive that every Gram Panchayat tank will be first given to the self-help group of that area. If there is no self-help group and if they are not willing, only then they will be auctioned. So this plays a huge role in income generation and also nutrition management, because fish is a very popular item in Orissa, and protein, it's a huge source of protein for our women and children. So around 4,300 SHGs were involved in fish rearing in the Gram Panchayat tanks. This is a progressive policy of the government. Next, in vegetable and mushroom cultivation, after being trained over the last so many years, vegetable cultivation was taken up aggressively in green zones. Next, hospital diet management in Orissa. Hospital diet management in many areas as per government policy is done by our women. So again, that continued, giving our women some much needed, work as well as money in their hands. And needless to say, they do a very good job in this diet management. Next. Then due to the lockdown, many farmers were left with surplus vegetables. And because our SHGs were doing a lot of Ahar Kendra and hospital diets, and they were involved in the food business in panchayats and giving these free meals, they started picking up the surplus vegetables, the surplus vegetables from our farmers. We had a tie-up system with horticulture, and quintals of vegetables were picked up so that they could be used in the panchayat kitchens. Next. Dairy farming, which is a common activity that women undertake across states, is also in the focus, and on the milk route, dairy picked up. Next, along with dairy, goat rearing was a very, very big activity, is a big activity. So that was also encouraged. Much of Orissa was green zone at that time because migrants hadn't started coming back. But when they came back, had a So paddy procurement is a huge area where our SHGs are involved. Traditionally, primary agriculture societies do this, but the commission is good, work is so good that our SHGs took it up freely. Again, this was a government policy, and per SHG, they earn 4 to 5 lakhs in one season. And you'll be amazed to know that they do the iris scanning, the biometric reading, identification of farmers. They are fully computer trained. And among them, they have the data entry operator also, because our paddy procurement happens online. Next. Then under MG-NREGS, our SHGs have been made farm pond supervisors. So the entire supervision charge goes to SHGs. So because this was an area where this was a time when work was needed, across villages, works were started with SHGs. So this was the next phase where they took off economic activities. Then, can you go to the next slide? Orissa being a state which has a lot of migrants coming back. When trains opened up and people from Surat and Mumbai from all the hotspots returned, our government had this initiative to set up temporary medical camps so that everybody who's coming back from any place is mandatorily to stay in a quarantine center outside the Gram Panchayat for 14 days. And these were beautifully run with food being managed by our self-help groups. maintaining social distance, and also preliminary screening was done with Anganwadi and Asha and with these ladies who have been trained. So food provision in our quarantine centers, which is now the phase that is going on, is being done with our self-help groups. Next. But across all this, we have not forgotten that financial support is the main thing that will help women to get out of this time, because yes, livelihood has got affected, even though we are trying to get it back on track. So bank linkage is something that we are focusing on, and Orissa government has a policy where up to 3 lakhs, it's a zero interest loan for our SHGs. Means if they repay it, it's an interest subvention, a back-ended subsidy which goes directly into their account. So we encourage banks and we encourage our women for loans during this period, and we pay the entire interest. Next. Of course, many of our SHGs with even their small kitties have contributed heavily to the Chief Minister's Relief Fund also during this time, so that this money could be used for the corona management. So as you see over the phases, they have come out in leadership positions. They are in touch with block officers and district administration. They are in touch with sarpanches, with gram panchayats, and our administration depends very heavily on our 70 lakh COVID warriors. And they have also been included.
Sorry, ma'am, just a reminder, we have 5 more minutes.
Yeah, no, I'm just ending. So they have also been our self-help groups, because they are working in quarantine centers. They are all over the place with corona. They have also been included in this insurance policy of government, where anybody who contracts corona while on duty and there is an unfortunate death, then they would be paid 50 lakhs on par with doctors and others. So the thing that you hear from other states, that doctors are being treated differently and Asha, Anganwadi and others are not being treated the same way, though they're equally at risk. In Odisha, the same package that is there for them is also there for all our workers. So that is all I had to say. Next slide. And I'll be very happy to take any questions. And also, I'd like to add one line. Our SHGs are federated at the Gram Panchayat level. They have Gram Panchayat level federations, and also at the block level into block federation. And we do intensive training programs at our management centers. We have the Xavier Management Institute here, which is our premier management center. So we do leadership and executive courses for our block federation leaders in these centers, treating them on par with any leader of any discipline. Thank you.
Thank you, ma'am. So we will be having a Q&A round after Kusum ma'am's presentation as well. Jointly, we'll be having the Q&A round.
Yeah, right.
Now I would like to invite Ms. Kusum Balsaraf to share her insights on role of SHGs in COVID response. Welcome, Ms. Balsaraf.
Hello. Hello. Hello.
Yes, ma'am.
Am I audible?
Ma'am, could you hold your mic a bit closer?
Yeah. Hello. Good morning, everyone.
Yeah. Yeah. We can hear you.
Good morning, everyone.
Sorry, ma'am, your voice is a bit feeble. Sorry, your voice is a bit feeble.
Oh. Hello. Now I am audible?
Yeah, it's still a bit feeble. If you could increase the sound on your computer, if that should help.
It is full. It should be. Understand, yeah?
Yeah.
Now it's okay?
Yes, better.
Is it good? Yeah.
Yes, okay.
Yeah. To begin with, thanks a lot. To begin with, I would like to thank Ladli Initiative especially Dr. Sharada and Miss Anuja for providing me this opportunity to share the floor. It is a pleasure to me here for two reasons. First is today we are here to discuss about SHGs on a platform provided by organization working in child well-being. This itself is admirable because rarely any other sector than microfinance acknowledges the role of community organizations. Secondly, this course is conducted for emerging journalists and media people.
Kusumji, I would like to intervene and tell you your voice is very, very feeble. Please, if you could.
Actually, my this thing is absolutely on this thing. I really don't know. My net is also now. It is okay.
Yes, yes. You will have to be loud.
I'm so sorry.
Sorry.
Yeah, I'm so sorry. I'm so sorry. Yeah. Secondly, this course is conducted for emerging journalists and media people. It is very, very important that media understands the importance of community institutions in the development sector. Basically, I would like to go for the presentation now, and I'm really would like to see because the presentation has been shared with Swati, so I would request Swati to really share the screen. Yeah, thank you, Swati. Thank you. I think I would switch off my camera. It might be help us to work on the better. Huh?
Okay.
Please excuse me. Yeah. So if you we can see in these photos, basically the photos are the SHG members are engaging in distribution of grocery, conducting health camps for track pickers. They are doing some providing the meals through the government schemes, and this is something which is not a which is something which is absolutely the voluntary and spontaneous efforts. It is not people are doing their jobs. It's purely humanity spirit. These women are not from well-to-do families, but they themselves are from poor families. Most of them are also facing hand-to-mouth situation, but still they are facing this pandemic with organized spirit. They are helping government to reach out till last mile, working as frontline warriors. In this pandemic, all of us have seen the painful journey of migrant laborers. No one really bothered for them because if I remember the first session of opening session, Mr. Ketkar said he referred them as a disposable people who are not continued in any records. My point here is, though they travel as a crowd, they don't make a group, and their numbers do not translate into their strength simply because they are not organized. But SHG members who are from the similar state of the society, but they are organized and therefore they are being counted. For them, government had to declare policies. In first phase of lockdown, RBI has declared moratorium period for 3 months for the repayment of the SHG. And afterwards, it has been expanded for 3 months more. In short, it really underlies the importance of organized strength. I have witnessed the journey of SHG for the past 3 decades. As blessings in disguise, it was pleasant surprise to all of us as a practitioner. During the pandemic, we saw these self-help groups have gone beyond self-help to community help. Despite of their vulnerabilities, they become change agent. I think the question we should be asking is that how could this happen? And therefore, I would like to introduce my organization here. Swati, I would like you to go next. Hello? Yeah. So MAVIM is a Women's Development Corporation established in 1975, registered under Not-for-Profit Company Act. It is operational in all 36 districts of Maharashtra, covering 10,000 and plus villages and 259 cities. MAVIM has network of 1.37 lakhs SHGs, covering 16.10 lakhs households. Out of 1.37 lakhs SHGs, 1.3 lakhs SHGs are linked with bank who availed loan of rupees 3,000. It is a cumulative loan I'm talking about, 3,387.20 crores. And the best part of it, 99% of repayment. The actual default is just 0.05%. And it is amazing. Why it is amazing? Because if you see consider all the scenario around, you will find all the schemes wherever bankers are giving the loans. Even national return default rate is around 12%, 9 to 10%. So this is something the USP of MAVIM and its grassroots institutions. It could happen because MAVIM really believes in processes and is not just target oriented. It believes that Cooper has innate capabilities to change their own life. We believe in building capacities and making them confident to take decisions for their life. We are not taking decisions on their behalf, and therefore the ownerships come over there. We have built 474 grassroots institutions known as community managed resource centers. It is a people's institution by the people for the people. Each of these institutions is registered under Societies and Trust Act. Out of 474 institutions, 333 institutions are sustained on their own. MAVIM does not provide them financial support. This is an exemplary model in the country. That to that much scale, institutions has been sustained on their own. They're acting as a service providers. They providing variety of services to their members. For example, they are facilitate the bank linkages, monitor and ensure repayment disciplines, run agriculture centers and provide technical support and advisory to the farmers, ensure best practices in farming, acting as an aggregator to ensure access to non-exploitative supply chain. In short, they are performing role of civil society. Sati, please next. Actually, MAVIM is working with so many organizations, national and international organizations, and we do have a pride in that. I would like to express my gratitude towards them because their support, we could improve quality and outreach of our. Frankly speaking, these are the organizations where we could get the technical support. People generally used to say, कि Maharashtra being a big state, why they really need the support from the outside organizations. But I would like to tell is whether the support comes, financial support may be a very not maybe important, but an important thing is the technical support. Absolutely, these all organizations have really contributed into our work and our outreach also. Swati, next please. Yeah. So what I'm saying, because I have already explained what the SHG and SHG women have done to respond to the COVID-19. But here I would like to narrate about the strategies and the numbers. This is something which we can think. For example, when the lockdown has been declared, announced, the very soon, after soon we have asked my CRPs, that is the community resource persons, to establish the rapport with members, because they are having a rapport with the members. They know in the each village which SHGs, which member are the vulnerable, whether they would have the availability of the food or not. So they established the contact with them, understood the issues, understand how much amount of food is available with them, and then after, these women have supported them, the CRPs are supported them, either bringing to the support from the government missionary, or sometimes if it is not timely reached to the village, they have organized better of women to provide the meal to the vulnerable families within the village. And so we can say that in 10,900 villages, around 16 lakhs families where we are working, they don't have did not have face any starvation, and that is something very biggest achievement I could say. I always think this the numbers are it is something which is not given by the MAVIM or any funding agencies. This is their own efforts. their own efforts through, they have received that much leverage, crores of rupees, and they have supported lakhs of women, either for the grocery, either they have given the meal, they have conducted the campaigns, they have they stitched the mask. 20 lakhs March. This figure is every day it is growing. This is the figure which end of March. So 20 lakhs masks they have stitched and supplied to the APMC, health worker, rack pickers, medical stores, government officers. So this is something that timely, absolute timely thing has they have to really taken. So many women, the thousands of examples I can explain. For example, one woman who was working, the one example I'm giving, who was working as a maid servant, and because of and her husband was also without job because of lockdown. What she did, she just brought the vegetables. She took the loan of 2000 rupees, brought the vegetables, and started selling it. And now she is saying, I could not I could get more income than previously I used to get. So this is something very innovatively they have faced the lockdown. So my things are basically, the advantage with us was these community resource persons who are really, but this is the strength, this is the organizational strength which we could leverage. And therefore the importance, again and again, this crisis has underlined the importance of the institution building, and it is a worth investment. Generally the bureaucrats used to say ki, the training is not the it is something which is not, they feel it is a worth investment. But I could say this is the investment of human development index, and it has been really shown the merit of their own. Swati, please, next slide. Though I'm talking about so many things, good things about the SHG, it doesn't mean that they didn't faces any challenges. As we saw, all poor suffered lot, but the impact of COVID was not same for all. The gravity for section was different. In urban slums, people suffered more than rural, because rural people had some stock of the food grain, but slum people had no storage with food grain in the house more than 15 days. They were mostly dependent on the government supply of grocery and milk. Majority farmers suffered because they could not sold their harvested produce due to interrupted supply chain. The main sector suffered is poultry because of the rumors and perception created around chicken. Dairy people could save because because when milk prices gone down, government intervened absolutely. In the timely intervention was very protected, could really protect the dairy people. And what government has did, they have asked milk societies to procure the all milk from the households, and allow them and insisted them 5 rupees more to be given as per the per liter. And government has converted that milk into the producer milk powder. So I think these are the timely interventions has really saved this sector. The goateries also suffered to extent, because again rumor that after this pandemic people may not eat meat, and therefore goat prices will fall down, and therefore people started selling goats whatever prices they are offered to them. So mainly we observed nutritional intake of people drastically come down. Access to sanitary pads became an issue. Migrant workers who return from the Mumbai, Pune are mentally disturbed, hence families disturbed. Violence against women and children increased because of this frustration. Bankers who are otherwise also carrying negative impression about poor due to this COVID, they have become more skeptical about the repayment, and therefore farmers are finding cash crunch for input cost for Kharif season. And I think there is another slide of opportunities, but I would due to time constraint I would not really talked about it more, because we all know that the opportunities are very less than what we are suffering out of it, because they could work into the employment and mass generation वगैरह. But this is something is not really getting us to the resilience level. So I'll spend more time into the strategies. Swati, kindly go for the next slide. So what MAVIM did, MAVIM tried to have a concept. This is the something which MAVIM strategy, style of working. It is not something MAVIM decides at the headquarters. We had a consultation workshop with the community, with the district officers, with the staff of CMRC, and we come out with some strategies that we can segregate these strategies in two form. It is short term and long term. Definitely, we will need to continue to provide the food support to the poor and ultra poor. That is something we have to have continued. Helping poor to get ration card and Aadhaar card, as we know that in absence of ration card and Aadhaar card, lots of schemes they cannot access. Opening Janadhana accounts and access to loans through the banks through Tejas, and there is one Tejashri Government of Maharashtra scheme which will give the support to the ultra poor people and default which people, because we all know poor are not the willful defaulters. They have to have support and they should not be declared as the defaulters, but we should give some solutions and handling support to them, so that the Tejasri scheme is going to help them, so that people will have some amount of money into their hands. I think looking at the upcoming Kharif season, input supply through Krishi Seva Kendra on credit basis is a need, and therefore our CMRC which running the Krishi Seva Kendras are giving the input, the fertilizer, the
Sorry, ma'am.
pesticide.
Sorry,
Yeah.
ma'am. You have just 2 more minutes.
Yes, I'm just, it is the last slide, Swati. So this is something we are really doing through the Kushi Seva Kendra. And long-term strategy, we observe that whoever had as the nutritional level has gone down, so kitchen gardening we would like to really promote, grain banks we would like to promote. Grain banks is basically the traditional system in operational into the tribal belt. But we have seen and experienced that these women very smartly open a grain bank for the other member of who were not member of the grain bank, and therefore they could really prevent other families also from prevention of the starvation. So therefore we feel there is a need to create a self-reliant villages, self-reliant households. It means they should not be dependent on the other, at least for their essential needs. It can be done through the best practice of 5 guntas of strategy of which Mr. Palkar has promoting, and each family will have to have mixed cropping patterns so that essentials for consumables purposes would be available with them. At least survival will be ensured through it. We would like to promote group farming, to promote commercialized farming, to ensure good returns from farm. Developing people own farmer producer groups who can negotiate in market on its own behalf and ensure the fair deals. That is something we would definitely like to promote. And now there is one proposal under pipeline with UNDP. So we would like to really start the migrant support centers where migrants would be able to get the services of counseling. We would like to map their aspirations and provide the customized skill upgradation programs, because whichever migrant has some skills which may not be fit into the agriculture and rural part of Maharashtra. So there is a need to have a customized upgradation programs, and therefore we would definitely like to work with the variety of partners like VTPs, the Skill Mission, the Pratham like organizations, and this is something will give them the resilience. We feel these strategies maybe equip our community to face the crisis more efficiently. Thank you. Thank you. Over to Swati.
Thank you,
Now
ma'am.
I would like to receive the questions also. Thank you.
Yes, ma'am.
Thank you so much, Sujata ji and Kusum ji. About that, how the collective strength of the self-help groups actually came to the forefront. How self-help groups and worked tirelessly producing face masks, in running community kitchens, delivering food supplies, sensitizing people about the health and hygiene. In terms of hunger by running community kitchens at the Gram Panchayat level, ensuring that every household who did not have access to food got 2 hot meals each day. And this they did by supporting and picking up surplus vegetables from the farmers. And also how during the later stages of lockdown helped support the quarantine centers and the temporary migrant centers by that people who were access to food. Particularly in the role of the SHGs, how they work towards making villages by securing similar strategies, but also how the SHGs are now working closely to ensure customized programs are, created to identify and build skills of migrants. And this is the preliminary investigation is being done by the self-help groups. So thanks to both of you for bringing this out. And yes, definitely, like Sujata ji concluded, there can be no development without empowering women. And I think the SHG movement is one of the strongest movements in our country, whether it is the Kudumbashri, whether it's Mission Shakti, MAVIM, or the SHG groups in Bihar, Jharkhand that are attempting to empower women. Thank you, and over to you, Shiny, for the questions.
Hello?
Yes, you're audible, Shiny.
Okay. Thank you so much, Sujata ji and Kusum ji, for sharing your insights on the role of SHGs and how they are bridging the gap between the community and the government. Before we just move on to the Q&A session, I would just like to highlight that Population First has also been working on livelihood initiatives through vermicomposting. So we do have around 500 women who are engaged in producing vermicomposting and vermi-wash as a source of livelihood. And we do have women both from the tribal and non-tribal communities in the district of Thane. Yes, it has been a difficult period for them as well, but we are trying to help them, and they are also trying to cope and help the village systems in every way possible. All right, so moving on to the Q&A. Since time is again a limitation, I can only take 4 questions. And the first question, Sujata ji, is for you. What is your opinion about the role of SHGs bringing the fine balance between social distancing vis-a-vis social mainstreaming of migrant laborers from outside Odisha to villages without stigma? Sujata ji, you will have to unmute yourself. Hello? Hello? Swati, am I audible?
Yes, you are audible. Just a second. I'll just ask Sangeeta in the back to unmute, ma'am.
Sure.
Hello?
Yes, ma'am.
Yes, Sujata ji.
Yeah?
Yeah. Could you hear the question?
It says my video is disabled, so I'll talk, huh?
Sure. Yeah.
Hello.
Do you want me to
So your
repeat the
question was about social distancing and the issue of migrants going back.
No, I think you have to repeat.
So it is, yeah, I'll just repeat the question. What is your opinion on the role of SHGs bringing the fine balance between social distancing vis-a-vis social mainstreaming of migrant laborers from outside Odisha to villages without stigma?
Okay. Right. So Orissa had this policy of compulsory registration of anybody who wanted to get inside Orissa. So we had a count of whoever was coming by air, road, railway, and also by the migrant trains, the Shramik trains which were started. And we empowered all our sarpanches as district collectors. We empowered all the 6,800 sarpanches with full powers of district collectors so that they could run migrant centers with full financial autonomy, and this entire power was given to Gram Panchayats. It was not in the hand of the district or in the center. So, and our sarpanches together with our self-help groups, I would say self-help groups did not have such a major primary role in mainstreaming of migrants back. That will come back now. But our sarpanches and gram panchayats played a very huge role after the 14-day stay, when they come back home, how they are welcomed and how they are taken back to society. They had a huge role to play. Together with that, self-help groups, because they are the association of mothers, of wives, they took a great role sensitizing the community that no, for 14 days, our men, our boys have to stay. We didn't have this rule for women. Women were allowed to go back home, allowed to go back. They were we were asked to make them like camps, like NCC camps, where they do yoga, where they learn something new, where they train on certain courses. When most of our centers, our people they were did that panchayats with them ourselves.
Thank you. The next question is for you. How categorize households which are in need of dire help and those which can sustain themselves? Is there a data register maintained or a house-to-house survey that is conducted?
Actually, there is a
Kusumji?
system. Years together, we have developed one system. Hello.
Yes. Yes. Yeah.
Years to the identify the poor households. It's a very simple method, and this is something approved by the Gram Panchayat. So generally, what happens when we create BPL, the BPL survey? That survey, we all know that there are some whoever are into the power, they people are try to include their names if they are not even BPL. So, and who are absolutely remote people are not getting into the poverty line list, and therefore that list is really, really faulty sometimes. I'm sorry to say, but hello, yeah. Sorry to say,
yes,
but it is something.
Yes, you're audible.
Yeah. So sorry to say, but what happens, because of this, PRA listing is very, very essential. It is absolutely identified poor by the poor people only. The community organizations, they identified and that it approved from Panchayat. So it is very authentic list of poverty segregation. Over.
Right. Thank you so much. Thank you so much, Kusumji. Quickly, the next question, Sujata ji, for you. What are the ways in which SHG helps migrant women laborers who came back to Odisha after the continuous lockdown being declared? And is there a way that SHGs can help combat migration? Was I audible, Sujata ji?
Yes, I could hear you. So for migrant laborer, the first thing that the SHGs did was, as I told you, was provision food, take care of the hunger, and so migrant women. In many places, migrant women were housed separately. In many places, they were asked to go back home and stay there. So first was provision of food to them. Second was pregnant, their checkups. So together with the Asha and Anganwadi worker, they ensured that if they have missed any immunization, their checkups, the take-home ration, which is due for all pregnant women, irrespective of whether she stays here or she's registered somewhere else. So that was provided. Our first thing was to take care of their food and health. Then continuous monitoring regarding their health status in case they are showing symptoms. And Orissa is probably the only state where the treatment of COVID in private hospitals, which we have, the government has partnered with private hospitals, so that there is no pressure on normal hospitals. So that treatment is completely free for everybody. For the treatment of corona in hospitals is free. So then taking them to the hospital in case there were symptoms. So these were the immediate emergent needs. Then when it comes to what happens next, how do they get livelihood? So we are also working on a policy document where supposing the migrant woman or her family does not want to go back to where they came from. So involving them in our self-help group movement. So in every village, we have a number of groups. So absorbing them in whichever group she finds there is homogeneity in, so that immediately she gets access to funds. Because every group has their own savings, plus they take bank loans, and we provide seed money of 15,000 to every new group. So immediate question of funds gets solved if they are absorbed in self-help groups as per their need and as per their choice. So that is one thing we are looking onto. Then putting them into MG NREGS work sites, because all these works have opened where SHGs are supervisors. So putting them onto that, making sure that they, if they are PDS beneficiaries, then their PDS rations reaches their place. So these were the immediate steps that were taken by our SHG groups. On a long-term basis, how do we integrate them? How do we see their skills? That the government, part of government, we are working with a lot of other departments to have a broad-based policy, so that if somebody doesn't want to go back, or there is distress migration and they have been forced to go, so how can we retain them here?
Thank you so much, Sujata ji. Final question for you, Kusum ji. What are your suggestions on strengthening, and how to further strengthen the role of SHGs? In this context, and that can also probably inform some government policies. Your take on it, Kusum.
Actually, this context only give us lots of takeaway. The institution.
Kusumji, can you hold the mic closer to your? Can you hold the mic closer to your? Yeah.
I'm sorry. Institution being very, very essential, and institutions which can really have a proper governance, proper systems, which can deal with these issues. As CMRCs are doing the providing the services, similarly, we would like to have the farmers producer groups to be established, which is not sake of established. It has to be with governance. The organization should really work for the people, by the people. So this is the concept, and the democratical functions are very, very essential. Otherwise, Maharashtra has having a very, very long legacy of cooperatives. Though the cooperatives have lots of things, but still there are some issues also we have faced. The monopoly, the way I need to everything, but the cooperatives needs to run with a professional manner and with the proper governance. That is something we can really do it. Over.
Right. Thank you so much, Sujata ji and Kusum ji, for your time, for responding to the participant queries. Again, sincere apologies for not being able to take all the questions. Request Dr. Sharada to share her remarks for the first session. Thank you.
Thank you so much, Kusum ji and Sujata ji. It's really very, very inspiring, because it shows that if we really involve people in our activities, particularly women, and empower them, and we can achieve a lot of, we can address issues in a much better and efficient fashion without compromising on the choice and then the leadership of the local community. So I'm very, very happy that you have accepted our invitation and joined us, and made such beautiful, shared such beautiful experiences and such beautiful strategies that you have developed over the years to empower women, and also for engaging in community work for the people, by the people. That's the kind of a motto both of you seem to be having, and that's really amazing. Now we have with us, we'll start the second. Now we start the second session, and I'll be starting this session by sharing a personal experience of mine. I was invited by a journalism college in Bangalore to do a session on gender for their students. And around 20, I have asked just one simple question at the beginning of the session, to write on a piece of paper why they have joined the journalism course. 20 to 30 participants out of 40 participants said that they're entering the profession because it gives them an opportunity to meet interesting people, celebrities, and it gives them much influence and power. I was disheartened, and really very few people spoke about being the conscience creepers or opinion makers or being the watchdogs of the society to, help better implementation of programs, policies, blah, blah, blah. So it is really sad that the very purpose of journalism, which is to be sensitive, which is to be part of change that has to take place in the society, is not being seen as a very glamorous part of the profession. And the sensationalism, the visibility, the noise is what is attracting more and more of our youth to the profession. So we have with us today Mr. P. Sainath, who is exactly the opposite of that kind of populist journalism. And he has done seminal work on agrarian crisis and rural issues, and is one of the most respected journalists who pursues his calling with commitment and passion. I would just like to read out a quote of his, which I picked up from the internet, and it summarizes what he stands for. So I'm taking the liberty of quoting it. I quote, "You see it in the simplest and most direct way, the organization of beats. Many beats have become extinct. Take the labor correspondent. When labor issues are covered at all, they come under the header of industrial relations, and they are covered by business correspondents. That means they are covered by the guy whose job is to walk in the tracks of corporate leaders, and who, when he begins to look at labor, does it through the eyes of corporate leaders. Now find the agricultural columnist. In most papers, the idea doesn't exist anymore. If you lack correspondence to those two bits, you are saying 70% of the people in this country don't matter, and I don't want to talk to them." Welcome, Mr. Sainath, and I'm eagerly looking forward to a very, very inspiring speech, a presentation from you for these young and upcoming journalists who are looking at their profession and are very enthused about it. Thank you. Thank you for accepting our invitation.
Thank you. Glad to be here. Let's begin with this straight away. It's interesting that in the focus, the huge focus that we now have on the migrants, there are many interesting things about it. The first is that prior to March 26th, you will not find a single article, a single study in the mainstream media, what we call mainstream. You will not find a single beat or any regular reporting of migrants. It's as if they came into existence on March 26th. Second, I've been asked today to speak about the COVID-19 and the agrarian distress. Here's something. Many of those migrants, homeward bound migrants, not so long ago, were farmers or farm laborers or other allied occupations in the agrarian society. Maybe they were weavers, maybe they were tailors, maybe they were inland fishermen. Today they may be plumbers or carpenters or whatever, but many of them who came to, or headload porters more likely, many of them who came to the cities and towns so long ago, farmers, farm laborers, and people from allied occupations of agrarian society. So while we have a huge focus on why they are leaving, what happens there, how will they come back, if you want to understand anything of the migrant, you want to understand anything of their crisis, you should be asking the question, why did they leave their villages in the first place? That is the rubric of agrarian distress. In the last 28, 29 years, we destroyed not by calamity, but by design. We told ourselves that, oh, agriculture cannot absorb many people. I have to first semester in year 2000 in Andhra Pradesh, published a report, a report done for it by the McKinsey company, in which I think the very first page or second page said we need to get people of agriculture. It was absolute. Where do they go? There was a comfortable assumption that 9%. So we pushed millions of people out of agriculture by making agriculture necessary to function in. And it was also a movement towards corporatization of agriculture. Agrarian crisis in 5 words was corporate hijack of Indian agriculture. The second, what was the process by which that was achieved? 5 words: predatory commercial of the countryside. And what the outcome? The biggest human displacement in our history, achieved without tanks, guns, war. The Indian census of 2011 indicates there were more than 140 million migrants, and if you look at 2001 to 2011, there's a recording of something like indicating 54 million interstate migrants. By the way, those figures are huge, huge underestimates, because neither the census nor the National Sample Survey are geared to counting short-term migrants, footloose migrants. But they do count one category which is simply not being discussed. All migrants are not those who leave a village in Telangana for a metro in Mumbai. That is rural to urban metro migration. It's very significant as we are being forced to discover. But there is a gigantic number of migrants of people across the country, who are about to leave in March to go to another village, maybe in the same district, usually in another district, maybe in another state, just for the harvest, which will give them some work. So landless agricultural laborers, marginal farmers, and even very small farmers do this. This March, they were all stuck. They couldn't go anywhere. So they are in hunger. They are in very great hunger because those seasonal migrations, were not possible. Millions of people were stranded in their villages. If they got to some other place, very often they were not allowed into those villages. Barricades came up outside the villages in many parts of this country. It still is happening. And people had to quarantine themselves in the field. If they belonged to that village, they could do that and then go back after how many ever days it pleased the local authorities to enforce. Okay. So your census does not give you a real estimate of how many interstate migrants there are. Above all, it simply does not give you, neither the NSS nor the census has any count of the class of people we call footloose migrants. Footloose migrants are those who are running hither and thither without any clear final destination, They do not know 3 months from now. And this has been the group between 2001 and 2011. Say that as someone who has traveled with them, lived with them, journeyed in buses and tops of trains with them. These are footloose migrants. They might maybe get, if they leave Kalahandi, maybe they'll get 20 days of work pulling rickshaws in Raipur across the border. Maybe they'll get 50 days of work at a construction site in Mumbai. Maybe they'll get 15 days at a brick, or maybe they'll get 45, 50 days at a brick kiln in Telangana. The operative word is maybe. Maybe. Yeah. So they have no knowledge of where they're going. That is a life of complete and total insecurity. That is an explosive insecurity. It kills. So we need to look at now, many of those footloose migrants, the migrants to urban areas, are going back to villages looking for livelihoods which are not there. From 20 years, 25 years ago, they moved in much larger numbers than earlier to urban areas and other areas in search of jobs that were not there. So, say the maid who worked in our building for several homes, she was actually a very skilled farmer from Talegaon near Pune. She would go back at harvest time. She would go back at harvest time to supervise that on her ground. But farming could no longer sustain her because we had devastated farming by families and small people in favor of increasing corporate control over that sector. So why did they leave? They left because of this thing we called an agrarian crisis. That was there were other factors, but that was a huge driving factor. And you can see it in the census of India, the numbers. Between 1991 census and 2011 census, the number of farmers, by which I mean main cultivators, full-time farmers, those who spent more than 180 days a year on cultivation, the number of such main cultivators declined by 20 million. In 20 years, it declined by 20 million. It meant that every day on average, there were 2,000 fewer full-time farmers in the country. And we maintained that for 20 years. I have no idea what now the 2021 census will show because of the so-called reverse migration and how it's counted and who is counted, we really don't know. But I believe that between 2011 and 19, the migrations were even more intense as you see new colonies coming up in the peripheries of the towns. So that's just one set of problems that understand who these migrants are, understand that there are rural to urban migrations, rural to rural migrations, urban to urban migrations. There are a lot of urban to urban migrants. I'm one of them. And a tiny degree of urban to rural migrations. What we have no numbers on at all are footloose migrations, short-term circular migrations. Say a person leaves Kalahandi and arrives in Mumbai. If he is in Mumbai for 6 months or more, when he is enumerated by the census, he'll be counted as a migrant. He may have taken 3 years, 4 years to reach Mumbai. He might have gone from Kalahandi to Vizianagaram, to Raipur, to Kolkata, to wherever, and landed in Mumbai. That adventure of journeys of that fragile family, that doesn't get captured by any data at present. So now the second thing is situation on the ground. We are sending back, we are sending back in the sense that we made life impossible for these people and they don't trust us and didn't heed anything that your government or anyone said. And the extent the extent to which we marginalize them comes out so clearly in the 5 speeches made by the Prime Minister between middle of March and May 31. In the first 4 speeches, the Prime Minister never once mentioned the word migrant labor, never once. Maybe because of severe criticism of that, in the 5th speech, he mentioned migrant laborers once and the word laborer 2-3 times. Excuse me, I thought that this whole country was exercised over the plight of migrant laborers. If so, it ought to reflect in the Prime Minister's speeches to the nation. It did. On the ground, we are going back to an extremely volatile situation. Nothing has scared me ever about the Kharif season of cultivation as the coming one, for which June 15, we will start getting active. I'm really terrified of the Kharif season and what farmers will sow. You are in line for a lot of trouble. Why? In the last 25 years or so, we persuaded, part of the strategy of growth and hard currency and earning through exports and stuff, we persuaded, coaxed or coerced or bullied or pushed through credit millions of small farmers into growing cash crops, where earlier they were growing food crops and living off that. Now, cash crops are piled up all over the country. I'm sitting in Mumbai, Maharashtra. Some maybe 80 lakh quintals of cotton in Vidarbha are lying unsold with the farm of India, and at least unsold cotton lying with farmers of Maharashtra, mainly in Marathwada and with sugarcane. Lakhs of are lying unsold with the sugarcane mills that area. They're not sold. Globally, there is a huge crash in income and consumption. I don't have to tell you that. It's one of the very peculiar situations, very soon come, where in some sectors there is a fall in demand and supply at the same time. One, if you look at the people growing crops like watermelons, Tamil Nadu, Telangana, Andhra Pradesh, most of that crop is rotting in the field. It couldn't be picked up. You're going to have this situation, and this is what terrifies me. Governments are encouraging the farmers to repeat cash crops. Telangana has told its farmers to go for cotton. Punjab and Haryana are actually abandoning paddy because it's water guzzling and going to what? To BT cotton. Now, sugarcane growers are also going to do this. They're going back in the Kharif crop. Many of them will go back and grow sugarcane again. Do you see what I'm saying? You've got millions of tons of these things lying unsold across the country, the different cash crops. And you're going to grow the cash crop again. Once again, you're going to, repeating the same crops, which you have not been able to sell because you're being coaxed, persuaded to grow these crops again. Who the heck is going to buy them? Yeah, all the cotton growers across Vidarbha, if you visit, or Marathwada, you'll find their houses are piled with cotton to the roof. You'll find at the Ghatanji and other markets in Yavatmal, gigantic mountains of cotton which are unsold. And now you're going to grow millions of quintals more. That is terrifying. Because it is a direct and terrible danger to the food security of those farmers and their families themselves. For 20 years, yours truly has been debating, begging those farmers, at least attach one of your acres to growing food crop for your family, because there's a gigantic need for food security in your families. But people, the pressures of debt, the pressures of indebtedness, the pressures of payments, the pressures of rising costs of all those goods that the human beings need, that meant that cash was the top priority. And so people went more, and they used every inch of their land for cash crop. Now, you're in danger of a gigantic food problem by the end of the Kharif season. That's one danger. The second, of course, is that people will say, listen, no problem. There's 80 million tons of surplus food grain lying with the government. Yeah, the government has shown not the slightest inclination to distribute that food grain on a very significant scale, on any significant scale. It has not shown any inclination to, it has said this 5 kilograms, or in some places 3 kilograms, free distribution. Nowhere close to meeting the levels of hunger that are rising. You're having studies coming out of Johns Hopkins and elsewhere talking about how many children or babies are likely to die of malnutrition by the malnourishment related diseases, if you like. Let me get to that 80 million tons lying piled up with the government of India. Way back in 2000, Professor Jean Drèze, when the surplus was 63 million tons, when it was 63 million tons, he calculated that if you laid 63 million tons in the bags that it was packed in a single row, that row, it was more than twice the distance between the Earth and the Moon. So, you know, you've just had that idea of having economic reform of the public distribution system. We held those giant stocks to keep the prices in the market so that market prices won't be distorted. You have 80 million tons of surplus grain with about half the world's hungry. It makes no sense at all. Now in April, mid-April, I think around 12 or so, the government of India of rice of 80 million. They've not specified a figure, but they've given permission without a cap figure to be in all, so that you can make plenty of hand sanitizer. Isn't that? You're going to destroy food grain to create ethanol for people who don't have the water to wash their hands twice a day. Yeah. And about 100 Indian districts by this time have already entered their annual water scarcity cycle. And each and every one of these people is hungry, and we are destroying food crop to create ethanol, not just for hand sanitizer, but for blending with petrol. This is the completely callous and unthinking approach to the problem of hunger, which at least for God's sake is back on the agenda in this country, which it should never have left the agenda in the first place. The second is agriculture is also facing. Now, think, if you end up with mountains of unsold and unsaleable cash crop, it obviously means a diminishing of the amount of food crop you produce. I'm saying that what should be done immediately is to persuade the government should support farmers and urge them to grow nothing but food crop in the Kharif season, if that's possible, or at least the major share of their land should be devoted to food crop. Because a rise of 12%, that 12% rise is 20 rupees. And you haven't created a single additional day of work, not one cotton picking day of work additional. Indeed, if you look at NREGA number of days that people got under the rural employment guarantee, excuse me, if the number of people under the rural employment guarantee getting work in April and May this year was much lower than April and May the last year. Soon the monsoons are upon us, and we have never had a strategy for NREGA works in the monsoon. Yeah, we've never really had a very significant thing for that. Some amount of it, but not really. So and maybe up to 20 million people are going back there who are going to need that work. Why do I say 20 million? We absolutely have no clue of what the scale of human movement is. But we have a statement from the government of India that between May 28th, 9.1 million people moved back on the Shramik trains alone. Yeah. By which time, that was May 1, people had been moving for 36 days from March 26th to May 1. Now, your number of days shown for NREGs has fallen, and millions of people are returning to that situation. Second, if you provide those days, have you thought out, have you planned out? The statement of Nirmala Sitharaman's first package said NREGA work to be enhanced with strict observance of social distancing. Please show me where that is possible and how it is possible. Let's take a paddy procurement center that's producing, say Nalagonda in Telangana, which is producing a large number of working days in a short period for agricultural laborers. Already, the shortage of work is so great that the agricultural workers in that area are working alternate days so that everybody gets a chance. Not all of them will be used at that procurement center every day. They have to do it alternate days, which shows you how little the work is to be. The work is very hard, but it's not enough to be to meet all agricultural laborers on all days in that village or surrounding villages. What happens? Do you know that, say, 48 people are working in that particular, and there are 7,000 such paddy procurement centers over there. 48 people handle, pick up, pile up, clean, pack into bags, close the bag, sew the bag, weigh the bag, put it on a truck. They have to do 128 tons in 10 hours, which means, my friends, they are handling 213 kilograms a minute. Every minute, these individuals are handling 213 kilograms a minute. And that's a very standard practice across the paddy procurement centers in most places. Now, to do that with that speed, 12 of you, these 48 are divided into 4 groups. 2 will hold the bag, 2 will create the pile, put it in, everybody will stamp on it to close that bag. What physical distancing will you do? Second, you wear a mask over there. There's an enormous amount of dust. Paddy dust is that white dust. I know how it sets me off sneezing. And you've got that enormous amount of dust. And if you try wearing a mask, it's soaked in 40, 50 seconds. Because the temperature, by the way, is a pleasant 45 degrees. So imagine what happens. Your mask, simply you throw it off after a while. You can't breathe in it. Have we seriously given any thinking to how to reorganize work? First of all, we haven't even found out, we have not even organized work for them. And then we have to reorganize existing work. We haven't worried about that. So that's another huge problem that's coming up. Fourth, in agriculture, distress in agriculture has also been heightened and will continue to be heightened perhaps more rapidly by the process of climate change, which we have no discussion on in this country, not in the political public discourse at all. It's treated by media as something discussed in Paris, by heads of state, and our Prime Minister is doing a great job, everything else, etc. So, the protocols which are there in place, it's as if you and I have no role in it, you and I have no agency in it, which is untrue. Yeah? The process of climate change is devastating the nomadic pastoralists who you will find in the eastern Himalayas, in the western Himalayas, in the deserts of Kutch, all over the country. These nomadic pastoralists, they are really, really in deep trouble. Yeah? We know about the migrants walking on the highway. We don't know too much about them. Tell me, how do you lock down 300 camels? Try it. Yeah? 300 hungry camels, how do you lock down? How do you place restrictions on movement? How do you reach food out to people roaming, who are grazing yak at 19,000 feet above the sea level? Because the supply chains have collapsed completely collapsed, that even any serious government official accepts and tells you, though not our leaders. So you've got the problems of cash crop versus food crop. You've got the problem of climate change, which is going to exacerbate desertification in places like my home state of Andhra Pradesh. Anantapur in Rayalaseema is a classic example. Once a home of millets, shifting to a cash crop called groundnut, which has made Anantapur rather like the Sahel in Africa by destroying all other vegetation around it, leading to deforestation, leading to all sorts of things, and leading to misuse of water and borewells. Anantapur has a borewell bearing capacity of 70,000 borewells. It has 250,000, a quarter of a million. So you've got a coming water crisis. You've got the climate change breathing down your neck, literally. You've got a hell of a lot of other issues coming up. It does not look good for agriculture. What happens when our migrant friends go back? There are examples from your own society, from your own country, of what happened in the past. In 2008, when the Wall Street collapse occurred, lakhs and lakhs of, I would say, thousands of crores of rupees worth of orders were cancelled by Western, by Western parties that were importing goods from, say, Surat in Gujarat, where we have this large concentration of power loom karkhanas. Power looms. I doubt you'll find a single Gujarati except the owners. The workers are all from Odisha. Over 100,000 of them were from a single district in Odisha called Ganjam. Yeah. There is a train between Berhampur in Odisha and Surat. It's called the Berhampur-Ahmedabad Express. It always travels packed, and 100% of its revenue, mostly 80% of its revenue, comes one way from Berhampur to Surat. And almost all the passengers are migrant laborers. You can get onto the train and check it out if you like, okay? But it's been done for you. So the thing is that when those orders were cancelled, the power loom owners just laid off a lack of people. 40,000-50,000 went back to just the district of Ganjam. What happened when they went there? Ganjam had very good performance in G. Had other, one is an insurance agent. They all send remittances to the farm, and at harvest time they claim their share. Or if it's not the old father, it's the eldest brother. This is entirely a male-dominated thing, right? So the eldest brother will run the farm, and 3 younger brothers are all over the country sending in their remittances, claiming their share of it. When those 3-4 brothers in farm after Ganjam returned, it led to tension, violence, brother killing brother sometimes, a gigantic increase, as you would imagine, in domestic violence and domestic abuse. It led to a general rise in the crime rate. I'm not saying it should lead to any of this, not at all. I'm saying that's what happened. Yeah, you have to be warned against it. You have to know that. You have to know what the possibilities. Possibility is the Prime Minister called this a bogus program, told the Congress that he would shut down their stupid, corrupt program, and then had some reality, and to the reality, and 2 years later claimed that they had made the highest allocations for NREG. It's untrue, by the way. They did what they had done in the last year. But there has been no significant expansion of the NREG. Fourth, I'm saying you need, and if you need to expand that NREGA massively. Sixth, you need to start distributing very soon those so-called surplus stock. Seventh, you need in the NREGA to figure out different kinds of work, different kinds of things where you can also look after the health of people. I am also saying something that I said on March 26th. Whether you are able to organize the work or not, whether there will be work or not, every marginal farmer, marginal agrarian society person, not necessarily farmers, certainly every single farm laborer in the country should be paid NREGA's wages every day, regardless of whether there is work or no work, until the crisis tides over. Please know that the United Kingdom, considered a horrible laggard, a conservative government considered a horrible laggard in the handling of the COVID crisis, nonetheless paid 80% of the salaries, incomes of self-employed people right through the crisis from when its lockdown began. And your people are far more marginal, far more fragile than their British counterparts. Just shut up and pay those wages. Shut up and pay people to live. Yeah, you're going to have such gigantic problems. Further, you're going to have to invest in a gigantic national health system. In 1946, the first Indian Health Commission said this. It was called the Bhore Committee, headed by Mr. Bhore, I think from Maharashtra. It wanted the kind of national health system that the British built and that conservative governments there undermined. But it was a beautiful system for 3-4 decades in Britain, held up by doctors and nurses from India and the Caribbean. Okay, we don't have anything like it here. That would be a huge investment in your people instead of making jugglery of 20 lakh crores for 20 lakh crores for 10% of the GDP. It's nonsense. There is no such package. There is a lot of packaging. Packaging is what we've had at conference after conference of Mrs. Nirmala Sitharaman. Less than 1% of your GDP it accounts for. You are the lowest spender of the big nations on a stimulus package. And much of that stimulus package will go to the corporate sector, will go to the big companies. It will not help the 122 million human beings who the Center for Monitoring Indian Economy says lost their jobs in just the 1 month of April. Just that month of April. Now, many of those jobs, who were they? 91.3 million were street vendors, hawkers, tiny kirana stores, and little dabas, restaurants. I'm afraid that 30 to 35% of them are unlikely to ever reopen. So you've got to start looking at your employment problem. Is there something that can be done about it? Yes, you can. You can live up to your constitution. There is a section pretty unique to just, I think, 2 constitutions in the world, Irish Constitution and the Indian Constitution. It's called the Directive Principles of State Policy. You will find your preamble, which everybody is reading out, and I'm so pleased that people are, embedded in those directive principles of state policy. Yeah. They wanted you to build a state, your founders, where people had the right to work, the right to food, the right to health. They had those rights. Yeah. Now, if we are going back and trying to think of normalcy as what existed before March 2020, then I think we're a bunch of idiots. What was normal before March 2020 was normal for you and me. It wasn't normal for people in the handicrafts and handloom sectors living hand to mouth, now on the edge of starvation. And not many people know, I'm sure a lot of you wouldn't be aware, that handlooms and handicraft sectors are the second biggest employer in agriculture, not IT or anything else. What was normal for us was not normal for those working in the factories of the urban areas, for those working for us as our maids, cooks, cleaners. It wasn't normal for them at all. And the first sign of a gigantic crisis, they showed you that it was not normal. I also want to give you a little piece of history, because I think that a generation is growing up that has been robbed of its history by people from my generation. Yeah. This is not the first time people are fleeing cities in India in a big number. In 1896, 1897, more than half the population of Mumbai fled between 1897 and 1904. It fled because of the bubonic plague. At that time, Mumbai's population was 8.5 lakhs. 4 lakh people left. Almost 50% of the population of Mumbai left. They were migrant laborers, largely from mill workers, and most of the mill workers were from the Konkan region of Maharashtra. They left. By the way, significant numbers of them came back. The reason why people came back then and why people will slowly come back now, maybe not in the same numbers, but they will, because we destroyed all options in the countryside. What options do they have? Already I am seeing that as people go back to Bihar and UP, new people are actually coming in. It's not visible to many people yet, but it's happening, that people are picking up and coming back because they are driven by hunger, they're driven by desperation. Agriculture has tanked, or their allied professions have tanked. They have to do that. What happened in Mumbai, that by 1914 or so, people started returning, even though the bubonic plague didn't leave was not eradicated. It vanished actually by till 1914. A group of the mill owners were divided. Okay, one group of slightly more enlightened capitalist owners, led by Nauroji Wadia, said, look, the way of bringing them back is to offer better conditions, better work, some kind of housing. And that's how Bombay's chawls began to come into being. The British government passed a law, created a trust called the Bombay Improvement Trust, City of Bombay Improvement Trust, which built some housing, though they probably demolished more housing, more dwellings than they built, but they built something. If you want people to come back, you want people to have their jobs, you're going to have to create decent work. You're going to have to respect people's rights. Instead of which, we are using this opportunity to squeeze labor further by suspending labor laws in many states, by increasing the number of workers working hours from 8 to 12. This is the situation. You need to implement, if you're going to approach this problem as normal before 2020, and you're going to think that you're going to do it with your old development strategies, I have news for you. That was development for you and me. Yeah, it wasn't normal for the bulk of this country's poor. It wasn't normal at all. Their lives have never been normal. The very condition of being poor, of being deprived, of suffering deprivation means that you are not normal and that your life is not normal. I think that if you want to approach any of these issues, you want to look at those problems. By the way, I invite you to look at People's Archive of Rural India, which I founded. There's a laborer for you carrying 450 pounds on a bicycle of bamboo, 200 kilograms. The bamboos are 42 to 45 feet long on a 4.5-foot cycle. But anyway, the People's Archive of Rural India Online, one word, ruralindiaonline.org. We didn't discover migrant laborers on March 26th. They cover them around the year. The biggest section in Pari is called the Rural in the Urban, which is about migrants. We cover them 365 days a year and therefore have some understanding of the complexity of these problems. And I am saying, and we are saying, you want to address these issues at all. It's not going to be in terms of this development strategy or that development strategy. Have your strategies, play in your sandbox, that's fine with me. But approach these issues if you want to have any hope of dealing with them and averting a much larger catastrophe than what we've seen. Then approach these issues through a framework of justice and rights. Food justice, health justice, right to work. And all of these are embedded in your constitution. By doing what I'm asking you to do, you would be honoring and upholding the Constitution of India. 3 Supreme Court judgments in the last 40 years, the last by Justice Ashok Ganguly, say the directive principles of state policy may not be enforceable like the fundamental rights, but they are every inch as important. The Constitution itself says these principles may not be enforceable in a court of law, but they are fundamental to the governance, that they inform the governance of the country. That's what the Constitution says. So whether you're a journalist, an activist, a teacher, a intellectual of various fields, a doctor, whoever you are, approach these issues. Yeah? Approach these issues through the framework of justice. The media are an extremely unjust, unequal, and profiteering sector in the last 25 years. Moved from a tradition of journalism that I'm very proud of. I have never wanted to be anything but a reporter in Indian journalism. I never took up offers of chief of bureau of international magazine in this country because it's so bloody boring to do that. It is such an incredible country to report and an incredible countryside. 833 million people speaking 780 living languages, a diversity that you can never describe. Yeah, such a fantastic place, and a media tradition which till 30 years ago tried connecting, had organic links with your journalists were Mahatma Gandhi, Ambedkar, Bhagat Singh. Yeah, not many people know Bhagat Singh was a professional journalist, and he wrote in 4 languages. He wrote in 4 languages, yeah, and was learning a 5th. And all this by the time he was hanged at age 23. I began journalism at age 23. Yeah, I'm saying, look at the kind of inspiring things that have happened in Indian journalism, and then look at it in the last 25, 30 years. You don't think it's journalism at all. I don't. I believe there are now 2 schools of journalism. There is journalism and there is stenography. And what you are seeing practiced in the corporate is largely stenography, and it is stenography, and they are stenographers to the powerful. Yeah, they're not even good courtroom stenographers who record all sides. They are stenographers to the powerful. So if you also need to revive justice in terms of what people's right to knowledge, to information means on every front. What am I asking you to do? I'm asking you to honor and respect the Constitution of India that came out of the freedom struggle. Approach these issues. You know, in the previous session and the closing, you mentioned Kudumbashri, the group. That is the group that taught me the concept of food justice. When they told me, they actually theorized it so brilliantly, saying food security, food sovereignty are very limited concepts. You can have them and still have great hunger. You can have food sovereignty, yeah, and people starving. You can have food security at an understood notional median level or average level and people hungry. Food justice would mean that those who grow food, the producers, should never go hungry, but which is what has been happening in 30 years. The Kudumbashri example also gives you ways of doing things differently, with, say, the principles which I hope non-governmental, non-profit organizations adopt, rather than becoming service delivery arms of government. The principle is we work with governments, never for governments. I think that's brilliant. In fact, I've appropriated it for Paddy. The concept of food justice is something I think also applies to health sector, to the health justice. It applies to almost every major sector marked by deprivation and poverty in this country. So my thing is, you want to do this, you want to start doing something about it. If as journalists you want to do something about it, do what Paddy does. Our slogan, our motto, the everyday lives of everyday people. We don't report celebrities. We don't even report much on intermediaries or saintly individuals transforming the countryside. We write about the lives of everyday people. We tell their stories through their voices. You will find that far more than experts, ordinary people are quoted. We do quote experts, but we put them in their place and don't give them an overweening weightage. Today, if there's a drought in Beed, Osmanabad, reporters descending on the place, the first place they will go and the last place they will go is for a quote, comment and understanding and backgrounding from the district collector, who may be someone from Rajasthan who arrived in Maharashtra 3 months ago, arrived in his post 3 months ago and knows nothing about the district. For us, sources are those, the farmer who has tilled the land for 40 years, she knows a hell of a lot more about the farm crisis than you and I do, and then more than the collector does. We need to reorient our entire approach, putting that we do journalism centered around people, their voices, their lived experience, their voices. All this you're going to be able to do if you function through a framework of justice and rights. Even the famous Prabhat Patnaik quote, which I leave you with, in debating John Galbraith's, Galbraith said, the economist Galbraith said, we must have growth with justice. Prabhat said, not possible. You need to have growth through justice. Work for that justice, you'll have a different kind of growth altogether. Yeah. So your framework needs to be around justice. Thank you.
Thank you so much, Sainath ji, for the hard-hitting presentation. They provided a very nuanced interpretation of the migrant crisis and its roots in agrarian distress of the past decades. The political, economic ideologies and self-interest of this global economy is marginalizing more and more poor and disempowered people. Time media moves beyond human interest stories and shows a mirror to our industrialists, policymakers, and political leaderships when it comes to migrant crisis. As Manisha ji said so beautifully in her session a day before, and as you have reiterated in your presentation, if you are in doubt, democratize, go to people. People live realities which will tell you what the situation is. Thanks a ton once again for accepting our invitation and for that very frank and powerful message to the students who are here listening to you. So I now request Shiny to please start the Q&A session.
Thank you so much, Dr. Sharada.
Shiny, would you maybe take 3 questions at one time and then we answer those?
Okay, you read out all the questions, Shiny.
Sure.
3 at a time, we can handle.
Okay. Okay, I think we have time, limited time, so we'll take 4. So the first question is, women are not even considered as farmers, let alone their issues be brought to the fore. How would you suggest it should be dealt with? And what are the strategies that we could plan to address it? The second question is, the government approach has mostly been about finance, so cash crops in place of food crops. And even the farmers get easily coaxed because officials talk money. How can we make the government responsible, and how can we as students get involved in this process? The third question is, should I go ahead, Mr. Sainath? Yeah, okay. Agricultural sector employs more than 60% of our working population. And with the reverse migration now, it is quite inevitable that they will start working back into agricultural sector. Should the government work on agricultural reforms that opens up the market and makes trade easier and profitable? Or should it give emphasis on setting up MSME or large industries in these 3-tier and 2-tier cities? Should I also address the last question, Mr. Sainath? So you can probably address all of them together. Last question would be, what's your advice to the future journalists to help narrow down the gap between the urban and the rural society when the mainstream media is influenced by politics and its main focus has been on TRPs? Over to you, Mr. Sainath.
Yeah. Thanks. The first of those questions is simply the most obvious reality standing out in farming and in every other sector of this country. Yeah. I have at the annual meeting earlier this year of the Institute of Advanced Women's Studies of Indian Association of Women's Studies, I had mentioned that thousands and thousands of women farmers committing suicide have not been recorded as farmers at all. And therefore, the figure of farmers' suicides, horrible enough as it is, 315,000 in 2 decades, is hugely an underestimate because it excludes most of the women, not all, but it excludes most of the women farmers who committed suicide. It only counts those women farmers who have land in their name. Yeah. Actually, the official practice is violative of the census definition of farmer. The census definition of farmer does not ascribe a gender to the farmer. The census says someone operate, it does not even appropriate it doesn't even assign a land size or holding size. It says anyone operating a plot of land, 180 days, their primary income from that is a farmer. It need not be a male, it need not be an owner, it can even be leased, whatever it is. But in practice, the Government of India's administrative machinery counts as farmers only those who have the land in their name. So thousands and thousands of tenant farmers who are not recorded, who commit suicide, tend to get excluded. Women farmers, how many women have land in their name? There are two estimates I know of. One is less than 12%, one is less than 8%. One is a maximum of 8% of women have land in their own names. So they're not going to get, I have been present when the Tehsildar's office or whoever it was, or a cop came to interview, say, the widow of a farmer who committed suicide. He will not ask her any question other than one. Patta dikao. In Maharashtra, Sat Bara. That's what they will tell her. Now, the fact is, the male farmer committed suicide, yeah, but she was the farmer of the household. 60% of the damn work on the farm was hers. He should be addressing her as a farmer. Yeah, but women are not farmers in our society. They are farmers' wives, or farmers' widows, or farmers' daughters, or farmers' sisters. We simply, it is a most regressive and, it is simply obnoxious, but that's in some levels who we are. So you need to change that. Now, by the way, that's not going to be changed by your APMC reforms or any such thing. It's not even going to touch that. It's going to make it a lot worse. Yeah, because it's accepting the existing gender, class, and caste distinctions and going ahead with corporatization. So it entrench existing inequalities and enhance new ones. Unless you have, there again I come back to it, you're not going to approach this, if you're going to fail if you approach this through any process other than justice. Yeah, there is, gender justice is a very important concept. Yeah, if you're not going to address that point of gender justice in the equal rights of women to land ownership, in the equal, there were some states which in redistributed land assigned pattas only as joint pattas. That was a good step, but I think 1 or 2 states out of 20, out of 29 actually practiced it. And others didn't even adopt that law. So this is, the thing is this, that you cannot change that without changing the entire issue of ownership of land. And I, question about agriculture sector reforms together with this. I think there are very few words that have been more abused, misused, and corrupted in the late 20th century and early 21st than the word reform. Labor reform used to mean improving the conditions of workers. It meant improving the working place conditions in which people work to give them a decent atmosphere, proper breathing. The 8-hour day came as a labor reform. Today, labor reform means the right of the owner to hire and fire. Yeah, ordinances have been passed saying that workers cannot form unions, that workers cannot, that workers will have to work 12 hours, and 3 states, BJP ruled states, Gujarat, Madhya Pradesh, Uttar Pradesh, are not even going to pay overtime for the extra 4 hours from a people who are hungry and starving. They're going to pay them pro rata for those 4 hours as well as they would for the other 8 hours. But agricultural reform is reform for the corporate sector, for the elite, not for the agriculturist. Land reform had an entirely different meaning. It created millions of smallholders in states like Kerala and Bengal. It created those small owners. Yeah, that is land reform. Abolishing the feudal elements, vestiges of that, a full-blooded land reform in the countryside is a revolutionary step. You're not going to see this government do that. It is going to do the opposite. And why? No, why this government? You did not see the UPA government of Dr. Manmohan Singh do anything. That was the government that brought in your SEZs Act, acquired millions of acres of, I don't know how many lakhs of acres of land forcibly from the peasantry. So governments working in the framework which we thought was normal are not going to do a damn thing about it. You want a full-blooded agrarian land reform that's going to come through mass movements and mass struggles and no other way, which is the way it came everywhere else that it did in the country. It came through mass movements, it came through mass struggle. Now, retaining these structures and talking about reforms, APMC reforms, what you've done is literally hand it over to the corporate sector. I was, it was bizarrely entertaining to watch a government official say, now a farmer in Tamil Nadu can sell his produce in Uttar Pradesh if he wants to. Oh, sure he wants to. And 84% of your farmers are small and marginal. Yeah. So they're just going to pick up their bag, be rejected at Toothukudi. They don't think the price is good and they're going to walk to Uttar Pradesh, right? Yeah. They're going to do that. No, they're going to give it, they're going to surrender it to wholesale chains, to supply chains. They're going to surrender it at a pathetic price. And the gain and the value will be taken by those who control that all India network. In other words, that freedom to sell anywhere is not the freedom of that time, or it's just in the way. Freedom of press in this country doesn't mean a damn in terms of freedom of the journalist. It means freedom of the media, which in the last 4 weeks have sacked and laid off, retrenched more than 1,000 journalists. The Hindustan Times alone over 150 or 27% of its staff. The Times, no one knows how they work, but it's a very significant number. Vikatan in Tamil Nadu have sacked more than 175 journalists, a single chain. Yeah. So I'm trying to tell you that this idea of reform, whose reform? In favor of whom? All that's happening now in that agrarian sector is what is being called reform, is going to deepen the crisis of the agrarian sector tremendously. And it is people to grow cash crop again, right? Not me. So these are their ideas of reforms. We are headed for a terrible, terrible situation. About finance and place of food crop and farmers being seduced. Please understand that farmers are under terrible pressure. What has been, many were shifted from food crop to cash crop by subsidies, by coercion, by coaxing, by using credit as an instrument, and intellectually by justifying this, as the World Bank and the IMF have done for 3 decades. Poor countries should grow cash crops because those days, 80s, 90s, food crop prices were very low. Yeah. And Canada and US were producing enough to feed the world, which of course, they never looked at the fact that it would make the world dependent on the United States and Canada. Yeah. Today we talk about make in India. But the fact is that millions of people were shifted. Why did those farmers go for cash, not only cash crop, but for anything that gave them a little more cash. They went for that because of the incredible bankruptcy, the incredible distress heaped on them by a system that changed the rules of agriculture entirely. Today in agriculture, what does the farmer control? Farmer after farmer has asked me across the country, why do you call us farmers? What do we control? Who controls seed? Farmers or corporations? Who controls pesticide? Farmers or corporations? Who controls fertilizer? Farmers or corporations? There have been 500, 600% increases in cultivation costs as corporations have taken over the agricultural sector. I can give you that in specific crops if you like, but this is what has happened. So what you're watching is a reform favoring the rich, favoring the ruling elites, and that is one. So the finance question, you know, how sad it is that we create a brilliant report headed of force, the National Commission for Farmers submitted 5 volumes between 2004 and 2006, producing the first, possibly the first blueprint of Indian agriculture. Please read it to know what kind of reforms you really free. It's online. You'll find it in the MSSR website. You'll find it in the website of People's Archive of Rural India. All the reports of the National Farmers Commission. In November, since 2018, I've been demanding that we have a 3-week session of Parliament exclusively to discuss agrarian distress. I am now saying we need a full session of Parliament, maybe the monsoon or winter session, to discuss nothing but mass distress, of which the agrarian distress is a major part. Please read the Swaminathan Commission reports, the National Farmers Commission reports. There's a hell of a lot about finance, interest rates, the whole works. We have many guidelines on how to do it. And that's why I'm saying again, you're going to have to do it through making it an issue of justice. Thank you.
Thank you. Thank you so much, Mr. Sainath, for your time. I'm sure all of us are actually grappling with all the realities that you have just shared.
Please,
sorry. Yeah, I request Dr. Sharada to please share her concluding remarks, and would request everyone to please switch on their videos for a group picture. Thank you.
Thank you, Mr. Sainath, and I hope all the participants have got their answers for the questions that they have raised. I know that we were not able to take all the questions and observations which are there on the chat box because of paucity of time. But I'm sure overall you have got an understanding of how to approach this issue and the hard work that you have to put in reading, understanding, and then having that commitment to justice and fairness when you're reporting on issues such as these. So with these, now we come to the conclusion of this session. Once again, a very big thank you to Mr. Sainath from all of us, from Population First, UNFPA, the participants. And we look forward to more interaction with you, more guidance to our students, because you are a role model for many of us. And it's so very important to be rooted and to have that kind of a commitment to do for justice and fairness. So thanks once again. Over to Swati for the concluding announcements. Thank you.
Thank you, Dr. Sharada. We would like to once again thank Ms. Sujata, Karthikeyan, and Ms. Kusum Balsaraf for the much needed perspective on how SHGs can have and will continue to play a significant role in responding to the COVID crisis, not just in the context of health, but also in the context of the overall community well-being. And once again, a big thank you to Mr. Sainath for such an inspiring session and helping us understand how the migration crisis is connected to the agrarian distress and how consequently this pandemic is impacting not only our food security, but is also impacting the people who feed us, our farmers. We thank you. We thank our partners and collaborators at UNFPA and our entire Population First team, and all the participants for joining us and enriching the session further with your questions and observations. Just wrap up instructions or details. As you all know, we have a survey going on, the boys locker room survey, which is to understand the young boys' response to misogyny and on social media. So we will be putting up a link on the chat box and also sharing it with you on your sending it to your emails. We really encourage you to share the link with all your friends and family members and get as many responses as possible. As for the blog competition, as Dr. Sharada today mentioned, now it is open to all the students. So we are so glad that you all will be able to participate in it now. The deadline is 25th of June 2020. You can write it in both Hindi and English. Word limit is 500 to 750 words on either child marriages, pre-birth sex selection, or female genital mutilation. Please send in your entries at trainings.popfirst@gmail.com, and we hope you all will actively participate in it. See you all tomorrow by 10:50 a.m. for the last day of our course. And just a reminder that the last session will for tomorrow will have a half an hour extension period, because we would like to wrap up and have a small valedictorian session. Thank you, everyone. Stay safe and have a good day.